Every year, strokes claim millions of lives worldwide. Did you know women are at a significantly higher risk of stroke-related death compared to men? What makes this even more concerning is that stroke symptoms in women are often subtle and easily overlooked. Recognizing these warning signs early can save lives, not just your own, but possibly someone you love. In today's video, we'll uncover the 7 critical warning signs of stroke in women. Please make sure you watch till the end, because after talking about the warning signs, we also discuss risk factors, prevention strategies, and treatment options. Before we proceed, please note that the information provided here is thoroughly researched and reviewed by health professionals. This video is for educational purposes and is not a substitute for professional medical advice. Always consult your doctor before making any health decisions. What is stroke? A stroke, medically referred to as a cerebrovascular accident, CVA, is a life-threatening condition that occurs when the blood supply to part of the brain is disrupted. This interruption starves brain cells of essential oxygen and nutrients, causing them to die within minutes. Strokes can happen to anyone, but women face certain unique risks and often present with symptoms that are more subtle or atypical compared to men. Key risk factors for women include the use of hormonal contraceptives, pregnancy-related complications, hormonal shifts during menopause. Recognizing these differences is crucial because timely intervention can significantly improve outcomes. With that being said, let's jump in and talk about 7 critical warning signs of stroke in women. 1. Sudden weakness or numbness on one side of the body. One of the most telling signs of a stroke is sudden weakness or numbness in the face, arm, or leg, typically on one side of the body. It could start as a mild tingling sensation or escalate to complete paralysis. Imagine someone trying to smile, but one side of their face droops, or they raise both arms, but one arm begins to drop. This is a clear red flag. Medical experts often recommend the FAST test: face drooping, arm weakness, speech difficulties, and time to call emergency services. Acting fast is crucial. The longer the brain is deprived of oxygen, the more damage occurs, potentially leading to permanent disabilities or even death. 2. Difficulty speaking or understanding speech. Has someone ever seemed fine one moment but suddenly began stuttering, slurring their words, or appearing confused by simple sentences? Difficulty speaking or understanding others is another common sign of a stroke. This occurs because strokes often affect the parts of the brain responsible for language and communication. The person might say words out of order, use the wrong terms, or fail to comprehend basic questions. For example, imagine someone struggling to name objects like a pen or glass, or responding incoherently when asked, "Are you okay?" Observing these symptoms and acting quickly can prevent irreversible damage. 3. Vision problems. Blurred vision, double vision, or sudden loss of sight in one or both eyes can be another warning sign of stroke in women. Often misattributed to tiredness or stress, these symptoms occur when a stroke impacts the brain's visual processing centers. For instance, someone might have trouble reading text they could easily read before, or find themselves bumping into objects due to impaired peripheral vision. These changes may come on suddenly and should never be ignored. Immediate medical attention can make the difference between temporary impairment and permanent blindness. 4. Sudden dizziness, loss of balance, or difficulty walking. Imagine suddenly feeling like the world is spinning, struggling to take a step without losing your balance, or feeling too disoriented to stand. These symptoms are not just alarming, they're potentially life-threatening. Strokes can disrupt the brain's coordination and spatial awareness, causing severe dizziness and an inability to walk straight. A person may feel like they're about to faint or that their environment is moving unnaturally, a condition known as vertigo. If you or someone around you experiences these symptoms without a clear cause, it's time to act fast. 5. Severe headache, unlike any before. We've all experienced headaches, but what if a headache feels so intense and sudden that it's described as the worst pain of your life? This could be a sign of a hemorrhagic stroke caused by bleeding in the brain. Unlike common headaches, these come on abruptly and peak quickly. They're often accompanied by nausea, vomiting, or sensitivity to light and sound. A severe headache like this demands immediate medical attention. Ignoring it could lead to irreversible brain damage or death. Enjoying the video so far? Before we continue, make sure to hit the like button and subscribe to our channel so you don't miss out on our upcoming informative videos. 6. Unexplained fatigue or sudden exhaustion. Fatigue is a symptom we often dismiss, but extreme, unexplained tiredness could be an early warning sign of stroke in women. This isn't the usual weariness that a nap or rest can fix. Imagine feeling completely drained, even after a full night's sleep, and unable to muster the energy for basic tasks. This level of fatigue is often paired with other symptoms, like confusion or weakness, making it a critical indicator of a potential stroke. Number 7. Sudden changes in behavior or personality. Stroke doesn't just affect physical functions. It can disrupt behavior, mood, and cognitive abilities. Women experiencing a stroke may suddenly act disoriented, fail to recognize loved ones, or feel lost in familiar places. They might also undergo dramatic mood swings, shifting from calm to agitated without reason. These personality changes occur because strokes can damage parts of the brain responsible for decision-making, memory, and emotional regulation. Unique risk factors for women. Now that you know the warning signs, let's talk about why women are more susceptible. While some stroke risk factors are universal, such as hypertension or diabetes, women face unique risks, including hormonal changes from birth control or hormone replacement therapy, pregnancy-related complications like preeclampsia, migraines with aura. Understanding these risks can help women take proactive steps toward prevention and lifestyle changes. The good news is, many strokes are preventable with lifestyle changes. Here are some key tips. Maintain a healthy diet rich in fruits, vegetables, and whole grains. Exercise regularly to boost heart health. Manage chronic conditions like hypertension and diabetes. Limit alcohol consumption and quit smoking. These changes not only lower your stroke risk, but also improve overall health and quality of life. Treatment and recovery. Immediate treatment can make a world of difference in stroke recovery. Modern treatments include medications to dissolve clots and restore blood flow, emergency surgeries in severe cases to prevent further damage. Time is of the essence. The faster a stroke is diagnosed and treated, the greater the chances of recovery. Strokes can be devastating, but early recognition and action save lives. By knowing the warning signs, you empower yourself and others to act swiftly in a crisis. Did you find this information helpful? Share this video with your friends and family. It could save a life. And don't forget to like, subscribe, and hit the notification bell for more health tips. Stay safe, stay healthy, and remember, prevention is key.